Let me paint you a picture. You are 74 years old. You feel good. You are sleeping well. Your energy is steady. You are still doing the things you enjoy. Then one day, you go in for your annual physical. Routine. Nothing unusual. Your doctor looks at your chart and says, "Let's run a few tests just to be safe." 6 weeks later, everything changes. Now you are sitting in a surgeon's office, not because you felt sick, not because something was wrong, but because those just-to-be-safe tests found something. And that something set off a chain of events your body at 74 was never prepared to handle. And suddenly, the life you are quietly enjoying looks very different. This story, uncomfortable as it is, happens far more often than most people realize. But here is the truth that rarely gets said out loud. After the age of 70, some routine medical tests can do more harm than good. Not because medicine is failing, but because the math changes dramatically. And the truth is, nobody is sitting there doing that math with you in real time. What I am about to share does not come from a single opinion. It comes from years of studying medical evidence and observing what actually happens when the system runs on autopilot. And today, we are going to walk through 5 specific checkups that deserve a second thought after 70. But before that, there is one concept you need to understand. Without it, nothing else will fully make sense. I call it the longevity lens. At 50, screening works beautifully. You catch a problem early, you treat it, and you potentially gain 30 more years of healthy life. The investment makes sense. The math is clean. But after 70, 3 critical shifts begin to happen. First, many conditions found through routine screening in older adults will never actually harm you. They grow slowly. They stay silent. And in many cases, you will outlive them. But here is the problem. Once something appears on a report, medicine does not have a leave it alone button. It has a treatment button. Second, your body's tolerance for intervention drops. What a 55-year-old recovers from in 2 weeks, a 78-year-old may struggle with for months. Complications increase, independence can be lost, and sometimes the cost is far greater than expected. Third, and this is where it becomes dangerous, the cascade effect. One small finding leads to another test. That test leads to a scan. The scan suggests a biopsy. The biopsy leads to a procedure. And the procedure introduces complications. And just like that, someone who walked in feeling completely fine is now navigating a medical maze they never needed to enter. That is the longevity lens. Keep it in your mind as we move forward, because everything we are about to discuss connects back to this idea. Now let's begin with the first checkup, routine colonoscopy after the age of 75. Consider this carefully. A 77-year-old woman, healthy, active, with no symptoms. She had already undergone colonoscopies in her 50s and 60s. Both were completely clean. No polyps, no family history, no warning signs. But during a routine visit, she was told she was due for another one. She hesitated. She had concerns, but she did not want to seem difficult, so she agreed. The preparation the night before, the liquid meant to clear the system, hit her body hard. By morning, she was dizzy, confused, barely able to stand. She never even made it to the procedure. She ended up in the emergency room with severe dehydration and dangerously low electrolytes. Her heart was at risk. She spent 4 days in the hospital. And here is the uncomfortable truth. She never needed the test in the first place. Guidelines clearly state that for average-risk adults over 75, routine colonoscopy is not recommended, especially if there are no symptoms, no family history, and previous tests were clear. But the system often continues anyway. The risks are real. A tear in the colon can occur in about 1 out of every 500 procedures. In a younger adult, that is manageable. But in someone in their late 70s, it can mean emergency surgery, long hospital stays, and a recovery that permanently alters quality of life. And here is what makes this even more complicated. Many colon cancers found at this age grow so slowly that they would never cause harm within a person's remaining lifetime. But once found, action is almost always taken. That is the shift. That is the math most people never see. Instead of jumping straight into invasive procedures, there are safer alternatives. Stool-based tests done annually can detect real warning signs without the same level of risk. And if symptoms appear, that changes everything. Then yes, evaluation becomes necessary. But without symptoms, the question is not just can we test, it is should we test. That distinction matters more than most people realize. Now we move into something even more subtle and far more misunderstood. Aggressive cancer screening after 75. Let's be very clear. Cancer screening has saved millions of lives. That is not in question. But here is where the conversation changes. After 75, in people with average risk and no symptoms, screening begins to carry a serious problem. Overdiagnosis, and overdiagnosis leads directly to overtreatment. What does that actually mean? It means modern imaging is now so sensitive that it can detect cancers that are barely active. Tiny tumors, slow-growing, silent, the kind that, left alone, would never spread, never cause symptoms, and never shorten your life. You would live with them, not die from them. But the moment that word appears on a report, malignancy, everything shifts, the system activates, biopsies, specialist referrals, treatment plans, and it all moves forward, regardless of whether that cancer was ever going to harm you. Consider a 79-year-old man, still sharp, still independent, living his life, enjoying his weekends. A routine PSA test comes back slightly elevated. Nothing dramatic, just a small signal. But that signal leads to a biopsy. The biopsy confirms a low-grade, slow-moving prostate cancer. Now here is where things turn. Treatment is recommended. Radiation therapy. It sounds proactive, responsible, safe. So he agrees. But within 1 year, his life looks very different. Chronic fatigue sets in. Urinary problems begin. His overall quality of life drops significantly. And here is the part most people never hear. Many men in this situation, looking back, realize that their cancer was the kind they would have lived alongside, not died from. But that understanding often comes too late. The same pattern appears in women over 70. Studies have shown that a substantial portion of cancers found through mammography in this age group are clinically insignificant, meaning treatment does not extend life. It only introduces side effects. And yet, the system continues to detect and treat. So what should you do? The answer is not to avoid screening entirely. The answer is to shift the conversation. Ask directly, if something is found, what are the realistic treatment options at my age? And more importantly, would we actually treat it? That single question can change everything, because it forces the focus away from detection and toward outcomes. Now we move to something that surprises almost everyone. Routine cardiac stress testing in people without symptoms. On the surface, it sounds logical. You are in your early 70s. Your doctor wants to make sure your heart is okay. So you step on a treadmill, or you are given medication to stress the heart while it is monitored. It feels responsible, preventive. But here's the reality. These tests can produce false positives at rates as high as 40% or more in certain groups. Think about that. Nearly half the time, the test may suggest a problem, when your heart is actually fine. But medicine does not ignore abnormal results. That false signal pushes you into the next step. A cardiac catheterization. This is not a simple test. A thin tube is threaded through your blood vessels into your heart. It carries real risks: bleeding, vessel damage, irregular heart rhythms. And in rare cases, it can trigger the very heart attack or stroke you were trying to prevent. And then comes the next layer. If a partial blockage is found, which is extremely common after 70, you may receive a stent. But here is where things become counterintuitive. Large clinical trials have shown that in stable patients, stents do not reduce heart attacks or extend life compared to medication and lifestyle changes alone. Read that again in your mind. The procedure carries risk, but the outcome is no better. And yet, once the process starts, it rarely stops halfway. So someone who felt completely fine moves through a chain of events: test, false alarm, procedure, implant, long-term medication, ongoing monitoring, and statistically, they are no better off than someone who managed their health with medication and daily activity. That is the cascade effect in action. So what is the alternative? If there are no symptoms, no chest pain, no unexplained shortness of breath, no dizziness, then the focus should shift. Blood pressure, cholesterol, blood sugar, movement, sleep. That is where the real impact lies. That is where outcomes actually change. Now we arrive at the final two checkups. These are the ones that often feel the most routine, the most harmless. But in reality, they carry consequences that few people ever stop to consider. Let's start with bone density testing. Osteoporosis is real. Falls can be devastating. That much is true. But here is where the conversation needs to be more precise, especially after 75. A routine DEXA scan shows low bone density. The result comes back, and almost automatically, medication is prescribed. Drugs like alendronate or risdronate. You are told they will protect your bones. You take them for years. But here is what often goes unsaid. Long-term use of these medications has been linked to rare but serious complications. One of them, atypical femoral fractures. Stress fractures in the thigh bone, the very bone you were trying to protect. And another, osteonecrosis of the jaw, bone deterioration in the jaw. Painful, difficult to treat, life-altering in ways most people never expect. But here is the part that truly shifts the perspective. The most effective way to prevent fractures in older adults is not medication. It is fall prevention, balance training. And yes, practices like Tai Chi have been shown to reduce fall risk by nearly 50%. That is not a small number. That is a major impact. Simple changes in the home. Removing tripping hazards. Installing support bars. Reviewing medications that cause dizziness. Checking vision regularly. Ensuring proper nutrition with enough protein and vitamin D. These interventions reduce fracture risk in a meaningful way, without side effects. This does not mean medication is never appropriate. There are cases where it is absolutely necessary. People with prior fractures, very low bone density scores, specific risk factors. But for an active 74-year-old who has never broken a bone, automatically starting long-term medication without discussion, that deserves a pause. A real conversation. Because the question is not just, what does the scan show? The question is, what actually reduces my risk in a way that protects my quality of life? Now, the fifth checkup. This is the one almost nobody talks about. Carotid artery ultrasound screening in people without symptoms. It sounds logical. The arteries in your neck supply blood to your brain. If there is a blockage, you find it early. You fix it. You reduce the risk of stroke. Simple, clean, reassuring. But the reality is far more complicated. The procedure used to fix a blockage is called a carotid endarterectomy, and it carries a 2 to 3% risk of causing a stroke during or immediately after the surgery, 2 to 3%. And in older adults with other health conditions, that risk increases. Now think about this carefully. Many people over 70 already have some narrowing in these arteries. It has been there for years. Stable, silent, causing no problems. But when you look for it, you find it. And once it is found, the pressure to fix it begins. But here is the danger. The very act of trying to remove that blockage can dislodge a small piece of plaque, sending it directly to the brain. The outcome you were trying to prevent can be triggered by the intervention itself. This is why routine screening for carotid artery narrowing in people without symptoms is not recommended. Because in this situation, the risk outweighs the benefit. So what should be done instead? Focus on what actually drives stroke risk. High blood pressure, the single biggest factor. Blood sugar control. Quitting smoking. Managing heart rhythm conditions like atrial fibrillation. Staying physically active. These are the levers that truly matter. And if any neurological symptoms appear, even briefly, sudden vision changes, facial drooping, weakness, severe headache, that changes everything. That is when immediate evaluation becomes critical. Now, before we close, there is something practical you can take with you. A simple framework. 5 questions. Every time a test is recommended, especially if you are over 70 and feeling well, ask these. What is the false positive rate for someone my age? If something is found, What are the realistic treatment options? What are the risks of those treatments? What happens if we monitor instead of treating? And what is the most effective non-invasive alternative? These questions shift the conversation. They bring clarity. They protect you from being pulled into a process you may not actually need. Because at this stage of life, the goal is not to find more things. The goal is to live well, to protect your independence, your energy, your ability to do what matters most to you. And here is the truth. Sometimes, doing less requires more wisdom than doing more. Sometimes, choosing to watch carefully takes more courage than rushing into action. You have the right to understand what a test is looking for. You have the right to know what happens next. And you have the right to decide whether that path truly serves your life. If this gave you a new way to think about your health, share your thoughts below. Have you ever gone through a routine test that led somewhere unexpected? Your experience might help someone else make a better decision. And if you found this useful, consider following and staying connected. More conversations like this are coming, focused on helping you protect what matters most in the years ahead. Take care of yourself.